So this is the lateral view. You are looking at somebody's leg on the lateral side, okay? So this is anterior front, that's posterior. So technically, this is your popliteal fossa. Is that clear, folks? Popliteal fossa is always in the posterior side, okay? And remember, popliteal fossa has one artery that you could feel the pulse, right? What's the name of that artery? Popliteal artery, easy. Okay, so that's popliteal fossa, popliteal artery fossa, okay. Now, whenever we walk, we do all those things. There's something called alignment. This should be like this. This lower leg should never come anterior. It should never come anterior because that's what ACL does. Anterior cruciate ligaments make sure it never comes out anteriorly. Is that clear, folks? It prevents the movement of anterior. Same thing, there's a ligament on the posterior we call PCL, so that prevent the leg to go posteriorly. So they always maintain on the same axis. Is everybody clear, folks?
I thought patella was anterior.
Say it again. That's a popliteal fossa.
Okay, never mind.
So the patella is right here. Okay, that's patella, and this is popliteal fossa, folks. Okay. Now that's ACL and that's PCL. Now, the function of ACL again to prevent the anterior motion, and the PCL is to prevent posterior motion. Everybody clear, folks? Sometime you could have a tear or some rupture of the ACL. If you suspect, we're going to have the patient to come and lay down in a certain position. You don't need to worry, but you could see that position here. And what will happen is I will put the hand on the back of the leg in the calf of the patient. I'll try to pull the leg anteriorly. In a healthy people, it should not come anteriorly. But if it comes anteriorly, it tells you it's ACL tear. Because if the ACL is normal, it wouldn't allow the leg to come anteriorly. So we call that anterior Drover sign positive. The minute you see anterior Drover sign positive, A4A, that's the easiest thing to remember. Is that clear, folks? That's anterior Drover sign. Now the same story, if I suspect PCL tear, I will have the same position. I will push the leg posteriorly. In healthy people, it should not go. But if it goes posteriorly, that's a PCL tear. Is that clear, folks? That is a PCL tear. Are you guys understanding it? All right. So posterior Drover sign positive, PCL tear. Anterior Drover sign positive, ACL tear. Are we clear? All right, those are two. Now, that's anterior motion and posterior motion. So if I were to draw the same leg, let's say we are looking at anteriorly. Okay, so that's your knee joint, and that's your fibula. I'm just gonna draw here. Okay, this is medial. And this is lateral outside. How do I know this is outside? Because you have fibula on the outside. Is that clear, folks? All right. Now in this joint, there's two ligaments, like this and like this. In the medially, we call medial collateral ligament, MCL. Outside, we call lateral collateral ligament. Is everybody clear, folks? All right. Let me erase this. Okay. Now you could see in here. So that's medial and this. I want you to think carefully. If somebody comes and hit this patient right here, this way, they are hitting the patient from outside, okay? When they hit from this side, what's going to happen? This leg will come this way, and this will also come this way. That will pop the ligament on the opposite side. You see that, folks? So whenever somebody get hit on the lateral side, it actually ripped the medial collateral ligament. Are we clear, folks? Because you are hitting this way, the leg is bending this way, the opposite side is the effect. That is what we call this one. Okay, now look at this. The force was here, it tearing the opposite side. Is that clear, folks? Whenever you hit from the lateral side, the medial side get the effect. That hit or the force is called valgus force. Okay, or we call that valgus stress test. That's a test we do. Okay, valgus, easy to remember. I'll tell you how. VALGUS. Okay, keep in mind, I'll come back to that. So anytime valgus is positive, we call it MCL injury. Is everybody clear, folks? Anybody has any questions so far? No. Now let's go back. The same thing. What if I hit somebody from medially? That means the problem should be on the opposite side, isn't it, folks? So if I hit somebody medially, it will rip the lateral ligament. That is called varus force, VARUS. So that get confused, valgus and varus, right? This is how you want to remember. Valgus has L mean lateral, that comes from the lateral side. Is that clear, folks? Whenever you have L, that's a lateral force. Okay, that's the best way to remember. Okay, unless you know a different way, this is the best one. Now you could see here, it's a varus force. How do I know that? The force is from here, it ripped this side. Lateral collateral ligament. So everybody clear, folks? Let's see if we can apply that.